Welcome to this video. Tumors are masses of abnormal cells that can grow and spread in different organs and tissues. They can cause pain, bleeding, infection, or even death if they are not treated. But how can doctors locate these tumors and decide the best way to remove them before the operation? Turns out tumor tissues have an unusual fondness for glucose, a phenomenon referred to as the Warburg effect. This peculiarity provides us with a golden opportunity to employ a well-known tool known as Positron Emission Tomography, or PET for short, to pinpoint the precise location of the tumor. Before the actual scanning takes place, the patient is intravenously injected with a unique substance known as a radiotracer. How is this radiotracer concocted, you may wonder? The process begins with a mighty instrument called the cyclotron. Its job is to accelerate charged particles and collide them with a target material, consequently creating radioactive isotopes such as fluorine-18. This particular isotope is commonly used in PET scans to detect cancer, and it is produced by striking oxygen-18 with protons. Now, for the radioisotope to attach itself to a specific organ, it must bind to biomolecules that are produced by the metabolism of particular tissues in the body. These biomolecules can take the form of sugars, proteins, or hormones. The final product of this compound is the radiotracer we mentioned earlier. Doctors have the ability to formulate a specific radiotracer depending on the organs or tissues they seek to examine. For instance, the fluorine-18 isotope, when combined with the glucose analog, 2-deoxy-2-fluoro-D-glucose, forms 18F-FDG, a radiotracer often used in tumor detection. Alternatively, 11C-acetate can be employed to diagnose and monitor an array of diseases, ranging from cardiomyopathy and prostate cancer to brain tumors. Once injected into the body, 18F-FDG amasses in the tumor tissue owing to its high demand for glucose. The fluorine-18 isotopes then decay to oxygen-18 in a relatively quick span, generating both positrons and neutrinos. These positrons proceed to annihilate with neighboring negative electrons, giving rise to a pair of photons that emit energy in the form of powerful gamma rays. The region housing the tumor tissue emits a profusion of gamma rays, which show up as vibrant yellow or red hues on the PET image, earning them the moniker of hotspots. These hotspots signify that the tissue or organ is utilizing a high amount of the tracer, indicating a higher metabolic rate or blood flow. Conversely, regions that absorb less 18F-FDG appear darker on PET images, identified as cold spots, indicative of a lower metabolic rate or blood flow. For example, a cold spot in the brain might be indicative of a stroke or dementia. The combination of hot spots and cold spots of PET reveals the full image of human activity and health. However, PET can only show the uptake of the imaging agent in the target organ and lacks the ability to show the anatomical structure of the body. Around 2000, with the advancement of technology, equipment manufacturers organically integrated CT equipment that displays anatomical structures with it, forming a new generation of hybrid modality that combines both anatomical and functional molecular images, i.e. PET-CT. It is a great organic combination and success of radiological anatomical imaging plus nuclear medicine imaging, which greatly enriches the amount of information for disease diagnosis and makes up for the shortcomings of the respective images, achieving the result that is greater than the whole. Thank you for watching, and if you want to learn more about PET knowledge, don't forget to subscribe to our channel.